Welcome to Healing Horizons, where we explore the intersection of science, spirituality, and real-world transformation through Ibogaine therapy. Today's episode is particularly close to my heart, as we're discussing the application of Ibogaine therapy for veterans grappling with PTSD. Veterans face unique challenges post-service, and PTSD can have profound and pervasive impacts on their mental health and overall quality of life. It's essential to understand these challenges in order to address them effectively. Let's begin by understanding PTSD in the context of military service. PTSD, or post-traumatic stress disorder, is a mental health condition that's triggered by experiencing or witnessing a terrifying event. It's common among veterans who have been exposed to combat, extreme stress, and life-threatening situations. The symptoms can include severe anxiety, nightmares, flashbacks, and uncontrollable thoughts about the event. These symptoms not only disrupt everyday life, but can also strain relationships and lead to substance abuse and other mental health issues. Ibogaine, which heralds from the root bark of the Tabernanthe iboga plant, has been used for centuries in traditional ceremonies by the Bwiti people of West Africa. Historically, it served as a spiritual sacrament and healing tool. In modern times, it's gaining recognition for its potential in treating various addictions and mental health conditions, including PTSD. But how does this traditional practice translate into contemporary therapeutic settings, especially for those who have served in the military? Veterans face a myriad of challenges when it comes to managing PTSD. Oftentimes, there's a stigma attached to seeking help, coupled with a lack of resources or long waiting times for set effective treatment. Traditional treatments like therapy and medication can be beneficial but often fall short of providing comprehensive relief. This is where Ibogaine therapy steps in, offering an alternative that targets the heart of traumatic memories and the behavioral patterns linked to PTSD. In today's episode, we'll hear from veterans who have experienced profound healing through Ibogaine treatment in Mexico. Their stories are moving and sometimes hard to hear, but they highlight the transformative potential of this therapy. One veteran shared how they felt reborn after Ibogaine therapy, finally able to put their trauma in the past and embrace life anew. Another spoke of how the experience enabled them to understand and process their trauma in a way that traditional approaches never facilitated. From a scientific standpoint, research supports the use of Ibogaine for treating various mental health conditions. While it is primarily researched for its effects on opioid addiction, findings suggest it may also significantly reduce symptoms of PTSD. Studies indicate that Ibogaine's interaction with brain chemistry can potentially reset neural pathways, enabling individuals to break free from entrenched patterns of thought and behavior associated with trauma and addiction. One critical aspect of Ibogaine therapy is its ability to address trauma at its source. Unlike conventional treatments that may mask symptoms, Ibogaine can help bring repressed memories to the surface, allowing for greater emotional release and cognitive processing. This deep level of healing can dramatically reduce the burden of PTSD, ultimately helping veterans reclaim their lives. With Ibogaine therapy, there's also a beautiful interplay between traditional healing practices and modern therapeutic approaches. It combines the spiritual, mental, and physiological dimensions of healing, offering a holistic perspective that's particularly resonant with those who have served in the armed forces. This synergy between old and new resonates well in Mexico, where such therapies are being embraced with both respect for tradition and a commitment to cutting-edge science. Safety and efficacy are paramount when it comes to Ibogaine therapy. It requires a well-supervised environment, preferably in a medical setting with trained professionals. This safeguards against any complications and ensures proper support throughout the treatment. Experts underscore the importance of a comprehensive pre-screening process to identify and mitigate potential risks, ensuring that patients are medically sound to undergo the therapy. For veterans considering Ibogaine treatment, there are numerous resources and support groups that can provide guidance and connect them with trustworthy clinics. Community support is vital, as it offers shared understanding and strengthens the healing process. It's important for veterans to feel empowered to explore these options, armed with knowledge and support from those who understand their journey. As we wrap up this enlightening episode, my hope is that we've illuminated the potential of Ibogaine therapy to not only treat but truly transform the lives of veterans suffering from PTSD. there's a larger conversation to be had about how we support veterans, particularly when they return from service. As such, episodes like this are crucial for raising awareness and fostering a community of healing and resilience. Thank you for joining me on Healing Horizons. Whether you're someone struggling with PTSD or supporting a loved one, remember there's hope and a path to healing. Until next time, take care and keep moving forward on your journey.